Hi, so my name is Mark. I'm a healthcare professional, and I've been working in the healthcare industry for over 5 years. I've had good ones, I've had bad ones, I've had places I worked that I like, I've had places I worked that I don't like. What I'm going to talk to you about is an experience that that had happened this winter. This winter, I decided to make a decision, and that was to live in my van to save up money for college and to pay off debt first. So I decided to live in my van. Me and my wife, we both went to go live in our van. I'm living in a nursing home. I'm working in a nursing home. And adjacent from the nursing home, there's a church. We go and we park our car on the church's sidewalk, and they don't say anything to us. I had permission from the administrator to be able to park my vehicle at his on his lot during that winter. Well, I worked there for about 6 months. And during those 6 months, I had caught pneumonia, and I ended up quitting because I couldn't get health insurance. They were supposed to give me health insurance, and they failed to do that, and thus I put my 2-week notice in, and I went and I worked for a different facility. Well, I'm sitting there, and I'm coughing up blood, and I'm adjacent from the nursing home. There's a church, and I'm sitting there coughing up blood, and I'm watching as all these church followers and leaders, they're all walking past me, and they don't even say hi. They don't even say hello. They don't even say how are you. Nothing. And I'm in a sleeping bag. I'm freezing cold. I made a poor decision, bad life decision, life choice. Doesn't mean it's the end of the road. It just means it was a trial and error. I was trying to save money for college, and it failed. But it gave me an opportunity to think about our healthcare industry as a whole and some of the gaps that are happening. One of them is, to me, doesn't make any sense. What doesn't make any sense to me is that healthcare providers are not given healthcare insurance the day that they are hired on. This causes a huge risk towards other patients and other residents. When you take on someone else as a new employee, you don't know what kind of viruses, diseases, what kind of bugs that they have. We test them for TB, our new employee. We'll test them for TB, as if that's the only disease that's out there. I firmly believe that every healthcare professional who works as a CNA, a nurse, an RN, an LN, whatever it may be, if you're working in the hospital, you're part of that team. You should get introduced with a healthcare package that would include having healthcare insurance from day one. The point that I'm arguing about is this. I'm a soldier for Christ. Now, if I was gone and sent to Iraq, they wouldn't send me into Iraq without a weapon, without healthcare insurance, or what would be the equivalent healthcare insurance, okay? They would give me a gun, body armor, and all that, and they say, here you go from day one, because you need it from day one. Healthcare insurances are important for their healthcare providers, so that way the healthcare provider can go and see a doctor or whatnot. And the idea that the healthcare practitioner would be responsible for paying for that is kind of not rational, because the fact is that when the healthcare practitioner has a need as to why he's getting the job, the reason why the healthcare practitioner is getting that job is because he needs money. He can't afford it. Purely. The reason why you get the job is because you need the money. Now, the industry, the business, the people that own it, the administrators, should be able to pay $50. What is it, $50? For healthcare insurance. Why not give it to your healthcare practitioners from day one? It would make more sense. It would be more rational, every reason in the book. It makes for a better healthcare industry as a whole. Offer healthcare insurance to your healthcare practitioners from day one. Want to be even a better healthcare industry? Offer your healthcare practitioners counseling services from day one, because you don't know where they're coming from. You don't know what they've experienced. Allow them to talk. Why not? Healthcare practitioners are people, and that's kind of what I'm complaining about, and this is kind of my food for thought. So if you really care at all, well, why not talk to your politicians and to your leaders and tell them, hey, give healthcare practitioners healthcare insurance from the day that they are accepted on. Allow them to see counselors with the guarantee that what they talk about will not end their employment, etc. Why not? I think it's necessary, and I think it's practical, and it needs to be instituted. My name is Mark. Thank you for listening to Food for Thought for the next 5 minutes, whole 5 minutes of your day. Must have been hard. Have a good day. I said 5 minutes, man. You still got like 5 more seconds. It's not over yet. Is it over? No? 5 minutes. I said 5 minutes.